This segment sponsored by Viking Psychiatry. Welcome back to another edition of Mental Health Matters with Viking Psychiatry. And today we're talking about new hope for treatment-resistant depression. And joining me is Sean Goddard, owner of Viking Psychiatry. Hey there, Sean.
Hi, how's it going?
Good to see you.
Same here.
Yes. Okay, so as we kind of think about this topic, how do you feel that ketamine will make a difference when it comes to traditional antidepressants?
Yeah, you know, we've talked about ketamine before, and I really wanted to revisit this because it's becoming more familiar for people, right? And we've treated a very significant amount of people here in Fort Wayne and seen a lot of success. People who typically look at using ketamine for mental health are individuals, like when it comes to depression, who normally have tried the traditional avenues, right? Like medications, and have had multiple medications fail them, tried psychotherapy, maybe had moderate or limited success, and really feel like they've hit a wall. Many of them that I talk to say that they feel like there's something wrong with them, that they're broken. And I don't believe that's true at all. I believe they just haven't found the right treatment. And so ketamine offers a treatment option that is a completely different approach to the treatments that we've been offering in psychiatry for a while. Okay, and can you just describe what that treatment looks like? Like, what is it? Is it something that someone has to inhale? Is it a pill? Like, what is it? Yeah, so there's a couple different ways that you can administer ketamine, anywhere from intranasal, which means sprayed in the nose, IV, IM, which means an injection. There actually is an inhaled version that can be done, but the main way that we administer ketamine at Viking Psychiatry is via IV. And so typically people come in, get an IV started, get hooked up to the infusion. The infusion itself is 30 to 40 minutes long in most cases, and then they have a time period afterwards where they're relaxing and recovering post-infusion. But it's designed to be, this is a very comfortable environment. This is not, you're not walking into like a cancer center, right? And it's all white walls and people right next to you. You're in a relaxing recliner in a dark room with kind of nebulights going and music in the background, really designed to intensify the effects and provide a calming effect and allow you to process while going through the procedure. Yeah, this sounds less intimidating for sure. And I've seen your facility and you have the comfortable recliners and a blanket there, and you know, you do make it cozy for them. And so who would be the proper candidate to receive this type of treatment? Yeah, so when it comes to depression, typically what we're looking at is somebody who has tried and had at least 2 medications fail them in the treatment of their depression. This necessarily doesn't have to be waited until you've failed 5 or 10 medications, been failed by 5 or 10 medications, or are gone through, for example, ECT, you know, some people call electric shock therapy, right? Electroconvulsive therapy. If you've tried the traditional approach and it's not effective, then you are potentially a candidate. But it's not just for depression. We've used this in PTSD with a lot of success, eating disorders, anxiety. There's a lot that we can do with this treatment because of the way that it works in the brain. One of the ways that I explain it to people is if you have a muscle that's wasting away, right, you go get physical therapy, you build it back up. And so, but if you have pain and those types of things, they might prescribe you pain medication or a muscle relaxer. That's treating the symptoms of the disease. The PT is treating the disease itself. The medications we've been using in psychiatry for a long time are essentially treating the symptoms of the disease. Ketamine and some of the other modalities that we offer are finally the physical therapy for the brain, right? They're treating the disease and causing growth and healing. Yeah, that is important. Tackle it from the root and not try to work on everything around it, really. And so as people, go through that experience, what type of results can they expect? Because one thing that we've discussed before is the fact that an oral medication can take a while, right? Weeks to see if it's even working for you. How does ketamine work as far as speed? Yeah, one of the amazing things is with ketamine is there's studies that show that we have brand new dendrites being formed in the brain in as little as 4 hours after treatment, right? So that growth is occurring. We see suicidal ideations terminated as little as one treatment. But I can use a young lady that I treated recently, struggling with depression, not doing well. We treated her after the first infusion. She's like, I really don't feel any different, right? Because everybody wants to feel better now, and that's understandable. And I talk about the stacking method and how sometimes it takes a few. And so she just finished her 6 infusions, and this is a young lady that is now reporting significant improvement in energy, motivation. Her depression scores are down about 80%. The first people to tell her they noticed a difference were her kids, right? Her kids were talking about how mom's coming back. And so those are the type of results that we want to see for everybody. We hope for fast, right?
Yeah.
But the most important is not fast, it's significant changes. So.
And what is the frequency that someone can actually take this and come see you?
Yeah, so we have 3 main protocols that we do. It's once a day for 3 days in a row. We have twice a week for 3 weeks, and then twice a week for 12 weeks, or 6 weeks, excuse me. And those protocols vary depending on what we're treating and the extent of what we're treating. And then a lot of individuals end up following up for what we call boosters, where they've gone through the process, they're doing well, but we give little boosters to keep pushing forward and continuing to cause growth and recovery. So
wonderful. Well, these innovative treatments definitely provide hope for those who are suffering. So thank you so much for sharing about it.
Absolutely. Thanks for having me.
And if you would like more information about Viking Psychiatry, we'll have their website listed below, and I'll see you after this break. This segment sponsored by Viking Psychiatry.